I'm pleased now to introduce Margaret Poppiti. Margaret, who is RN, BSN, MS, was a wife and mother of 4 children whose husband and 3 sons all inherited polycystic kidney disease. Her determination to care for her husband and her concerns for her sons led her to learn everything she could about the disease following her husband's diagnosis. She is governor-appointed member of the State Chronic Disease Renal Disease Advisory Board, and she's going to be speaking with us for 10 to 15 minutes, and she'll do her best to get it all in. It should be a great talk. Margaret, please come to the stand.
Thank you. Can everybody hear me in the back? Okay, if my voice gets low, Dr. Swanson, raise your hand and go like this, all right? I've been a caregiver for 40 years. In 1977, I was a housewife. I had 4 children, and I had a husband who had some weird kidney disease. He got it from his mother. His mother got it from her mother. So I was told that it came through the mother. My kids were fine. Not so. Each time there is a conception, there's a 50% chance of that child inheriting polycystic kidney disease. I did not know that. Okay. My husband went to the doctor, he came home, he said, I have to start dialysis. Dialysis? What's dialysis? I had no idea. So I go to the library because I intellectualize everything. I have to go to the library and look it up, and I look in 4 or 5 different books, and they all say the lifespan of a person on dialysis is 1 year. I'm like, oh my God, you're 41 years old. You're only going to live a year. What are we going to do? He said, calm down. That's old news. I'll be fine. And he was. He came home from dialysis after a couple of weeks, and he said, you know what, I'm working 2 jobs. I don't have time for this. You got to learn how to do this at home. I said, I have to do what? You have to learn to do this at home. I talked to one of the nurses, and she said she could teach you. And I'm like, oh, fine. Okay. So I thought, well, all right, I've got to go to the doctor with you the next time because I have to know about dialysis. I have to know what the machine looks like. I need to know these things. All right, so we go into the nephrologist's office, and I'm with my husband, and he said, who are you? I said, I'm his wife. And he said, I don't talk to wives. I said, excuse me? You don't talk to me? I'm the one who's going to be taking care of him. I'm the one who's supposed to learn about dialysis. I'm the one who is supposed to learn all this stuff, and you're not going to talk to me? He said, he'll tell you what you want and what he wants you to know. I said, he doesn't listen to you. He comes into your office and immediately turns you off. He comes home. I asked him, what did the doctor say? He said, I don't know. I turned him off. He said, well, it's his responsibility. It's his disease. I said, no. You have got to talk to me. So what did he do? He looks at me and he said, you wouldn't understand me anyhow. And I thought, oh, excuse me? I'm not smart enough to understand you, or I am not a nurse? Is that what it is? And he said, well, that might help. I know the nephrologists know who I'm talking about. I said, that might help. And I said, all right, fine, I'll go be a nurse. And he looked me bull-faced in the eye and he said, well, if your brain is as smart as your mouth, you'll be fine. And I said to him, my brain is far better than my mouth, and I will be excellent, thank you, just the same. And I walked out of the office. Okay, now what do? I had just signed up for something that I had no idea that I ever wanted to do. Fast forward, I did go. I went back to school. I went to graduated with honors from the University of Delaware. And okay, I got a graduation card from him also, by the way. Okay, I was dialyzing my husband at home. I was working at the VA and learning my profession. And my husband comes home and he says, okay, you've been working a couple of years. I think I'll go for a transplant. Okay, fine. So he goes to Jefferson and gets a transplant. Within 3 weeks, he's back at work. Everything is fine. He's doing great. Okay, that was fine. I needed to still know about dialysis because what if the other shoe dropped? What if the transplant failed? What am I going to do? All right. At that time, they opened the dialysis unit at the VA, and that's where I was, and that's where I was for the next 23 years. Okay, if anyone's worked at a VA hospital, they know they're very complex patients. And my husband was a very easy patient. I learned my profession at the VA. I learned how to take care of very complex dialysis patients, and hopefully I learned it well. The other thing I learned, especially from my meeting with the doctor in the first place, was to include families. I never wanted to have another wife or significant other to feel that they were left out, that they were not told what needed to be learned. Some people don't want to learn anything. Some people don't want to know about it. But those that do want to know, I think they deserve to know as much as you can give them. And so I became, from that lesson, I learned, number one, I'm a lot smarter and a lot stronger than I ever thought I could be, because I went through school and I did what I had to do. Secondly, I learned that I was an advocate. I wanted to be an advocate for my husband, for my family, for he was the oldest in his generation to inherit this disease, so everybody after him would ask questions. Well, did this happen to your husband? Did that happen to your husband? What did he do about this? What did he do about that? Well, the doctor says this. Is that right? Is this right? Whew. I ended up being the first line. They would call me first about anything that they thought had to do with kidneys. And I found I really enjoyed this. I enjoyed being able to give that knowledge to people who didn't have it. I was the one who, if your neighbor was going to start on dialysis, you would call Peggy. Peggy, come on over and explain to him so he's not so scared. I enjoyed doing this, and I still enjoy doing this, and I still do this. Okay, fast forward. My husband had a stroke in 1990. With the stroke, it impaired his left side. That was his dominant side. He still had his access in his right hand, his right arm, and he was still mobile. He still kept a sense of humor. He was fine. I then had to learn what it was like to navigate this world with someone who was disabled. That's a tough thing. If you don't have to do it, if you're not pushing a wheelchair, if you're not trying to find accommodations, you're not trying to find a bathroom that they can get into, that you can have a family bathroom where you can go in and help if you need to, that's a tough thing. And that's another thing that I could share with my patients and my patients' families that were coming down with perhaps a diabetic who was losing a leg and was worried about it. I could share with them, I could empathize with them, and I could understand. Okay, I'm going to leave my husband for a minute, and I'm going to tell you all three of my boys. Did you put up the picture? Oh, I don't know how to do that. Okay, there we go. All three of my boys, that's my husband and the older one. Okay, all three of my boys have inherited polycystic kidney disease. My oldest son, the second one down, received a transplant in 2007. He went to the University of Maryland. Sure, he was given the three choices: end-stage renal disease, death, dialysis, or transplant. What do you choose? Transplant. My father made out fine. He was back to work in no time. He went to the University of Maryland. The conventional wisdom then was to take out the kidneys, the polycystic kidneys. Wrong move. Okay, they took out the polycystic kidneys. Doctor held them in his arms, 15 pounds apiece. That causes a lot of problems. That causes a whole lot of problems in the insides. So when he came out from the operation, he had like 5 drains in his belly, plus the transplanted kidney didn't work. He didn't expect this. He expected it to be like his father, bing, bang, boom. He was in the hospital for 30 days before that transplant finally, thank God, finally did start to work. He's fine, 10 years post-transplant, and he's doing fine. But he had multiple problems because of him taking out these huge kidneys. I don't understand why they don't take them out when they are smaller, because it's going to progress, it's going to get worse, it's going to end up with dialysis or transplant anyhow, and do it before it causes internal damage. But that's another soapbox for another time. Okay, while I was in there, I was the best of both things. I'm a nurse. I understand the medical side, and I'm also a caregiver and a worried mother. All right, we go into the hospital. He's got all kinds of doctors. He's got the infection control. He's got the person who's taking care, the wound care nurse. He's got the nephrologist, got the transplant specialist. Everybody comes in, cardiologist. Everybody comes in to see him, and they take care of their one little part of the body. We, as professionals, don't like to talk to all family members. We like to have the family pick out one person that we can speak to, and that person can disseminate this wonderful knowledge we give them to the rest of the family. I think it needs to work the other way as well. Instead of having all these doctors come in for their one little section of the body, we need to have one person designated that the patient and the patient's designated person knows is going to talk to them every day and talk about the whole patient. I don't want to hear just about his heart. I want to hear about the whole plan, the plan of care for the whole patient. And I think that, I don't know, in 2007, the University of Maryland was very lacking in that. Okay, my second son ended up with end-stage renal disease. Well, what does he do? He's scared to death of a transplant because of what happened to his brother. He knows that his father made out all right on dialysis. He's also very angry because this is happening. So I have two sides of the spectrum. My oldest son is one who is very, very compliant with everything. And my second son is just the opposite. It's like, I'm going to die anyway. What do I have to care about it? I'll go, but they better do what I want them to do. Here I am. I'm taking care of two separate sides of the spectrum. And both of them, I love them, they're my sons, but both of them are adjusting, one poorly and one a little bit better, to their life. I can adjust, I cannot adjust. I can identify with the families that come through and say, oh my God, what do I do with him? He's yelling. What do I do about this? What do I do about... I can identify with that. I can identify with one. He won't go out. He won't touch anything. He won't eat anything out because he's afraid he's going to lose his transplant. I can identify with that. It gets a little bit difficult. Okay, what I'm going to do now is I'm going to go back to my husband. My husband in 1990 had that massive stroke. In 1998, after 15 years of functioning, his kidney failed. Now, you have to understand, my husband was saying, after he had the stroke, he would say, I died. I said, you did not die. You had a stroke. No, I died. I'm walking dead. This was before the television show was on. He was the Walking Dead. I said, no, you're fine. You're doing fine. You're going swimming. You're doing your therapy. You're doing fine. No, I died. When his transplant failed, he agreed to go back on dialysis only because I wanted him to. I'm not going to, it's not going to work for me. You know what? We need to listen to our patients when they say it's not going to work. Sometimes they really know. He went to dialysis religiously because I wanted him to. And he did poorly. And at one point, his transplant, his access clotted. When his access clotted, Dr. Gavin can tell you, I was on the telephone. I picked up the phone. I talked to interventional radiology that had seen him the day before. And I said, well, you need to clean up this mess. And Dr. Gavin, you need to put it in the central line. Blah, 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 blah. I'm talking back and forth. And my husband's sitting in the chair going, take me home, Peggy. Take me home, Peggy. Take me home, Peggy. And I'm like, what? Take me home. I said, I'll call you back. I'll call you back. Put down. I said, okay, I'll take you home. We have to talk about this. So I took him home, and he said, you know what? I'm done. I said, what do you mean you're done? What do you mean you're done? You did dialysis, and it's just a central line. That's all it takes. No, I'm done. He, during the course of time that he had started on dialysis in July, and this was in October, his fingers, his 4 fingers, on the only hand he had started to get dusky. He was going to lose his fingers. He had 2 toes on the side, the 1 foot that he could use that actually, they were almost black. He was going to lose the 2 toes. The hand was terribly painful, terribly painful. And he said, Peggy, let me go. I said, I can't do that. You know, it's so easy. I mean, everybody, what's the central line? Nothing to it. Let me go. The outside of me is dying. You're keeping the inside of me alive for the outside of me to die. So if I don't have my fingers, I can't shave, I can't take care of my personal needs, which he had done. He had actually was able to take care of bathing and bathrooms, everything. He said, I can't take care of anything. I'm done. I said, okay, well, wait a minute now. If you really are done, then you have to explain this to the kids because they think I could solve everything. And he said, all right, Okay, fine. And his last thing was, the Lord gave me, I got this access, I used it, the Lord's allowing me to stop now. I was going to do it as long as that thing was working, but that thing stopped so I can stop. His last dialysis treatment was October 7th, and he passed away on November 9th of 1998. And during that month's time, he had quality time with all 4 of his kids, and of course with me. When we got home from the dialysis center, and after the crying and the yelling and everything else I could do to convince him to get a central line, and I finally accepted the fact that he had made up his mind and I had nothing more to say about it, I picked up the phone and I called Dr. Cox, who was his doctor at the time. And I told him who I was. I told him what my husband had decided to do. And I said, you know what? As of this moment, I am no longer the caregiver. I am no longer the know-it-all nurse. I am no longer anything but a wife. I want hospice in here tomorrow morning. And God bless him, tomorrow morning, hospice was in my house. And we had quality time together. He had quality time with his kids. He was able to explain what he was doing. And he and our family together, we had, through this experience, we had no woulda, coulda, shouldas. I would have done this if I could. I should have done that. I could have done this. And that's a blessing. And that also is a lesson that I can share with the patients who are looking at taking their loved ones off of a machine, of the patients who are looking at nothing else we can do for your family. I can share that experience with them, and I can cry with them. And that's the end of my talk. If you have any questions, I'll be around a little bit later to talk to you.